everybody. I hope you had a great summer. It's almost Labor Day and the unofficial end of summer here in Michigan. And with that, we have seen the members of the legislature return to Lansing after a summer district work period. And we're hearing a lot of talk about the state budget. You may have heard that the governor did a press conference yesterday in regard to the state budget as the fiscal year comes to an end quickly. The fiscal year is going to end on September 30th. It would seem the governor and the legislature have not come to any sort of an agreement on the big question mark in the state budget, which is road funding. Despite what you hear in the media, both chambers have passed a budget. The House passed a budget, the Senate passed a budget. Those budgets are now sitting in conference committee waiting for action. But the problem is, as of 2 weeks ago, the members of the legislature still didn't have budget targets from leadership, and that's because of the fact that there is no agreement really around how to fund roads. So what we anticipate is that this is going to continue on through the month of September, and we will see a budget resolution right before the end of the fiscal year, if not in the wee hours of the morning on October 1st, when the new fiscal year starts. In fact, we have heard that Budget Director Chris Kolb has been charged with starting to draw up plans in anticipation of a potential state government shutdown. So I think that is certainly looming over folks in Lansing, and I think what I hear from members of the legislature is they're feeling frustrated and they want to be able to move forward with passing a budget. When it comes to the budget that we're concerned about, so there are different chunks of the budget, right? We're concerned about the Health and Human Services budget, and I can tell you both the House and Senate passed their budgets, and as with other pieces, that budget is now sitting waiting for action in conference committee. So the two budgets are different, and so what happens in conference committee is a small group of legislators come together to hammer out the differences and come up with one final agreed upon budget that will be put into the larger budget, which is then sent on to the governor. So the two pieces that we care about in the HHS budget, our two big priorities are funding for the Michigan Dementia Care and Support Program and an increase for the My Choice Home and Community-Based Service Waiver. So just to give you a refresher on both, for Michigan Dementia Care and Support Program, we saw that included in the final House budget with $400,000 in funding to take the program to 8 counties. And then we saw a placeholder in the Senate HHS budget. In talking with the chair of the Senate HHS budget, he says that his intention is certainly to put a number with everything that has a placeholder. However, he doesn't have budget targets yet, so until he has budget targets, he can't make any promises. But I think we should be cautiously optimistic and also feel really good that we were able to include what we were able to include in the House budget. We certainly picked up some new friends of the Alzheimer's Association along the way on the journey on this issue, including Representative Hoadley from the Kalamazoo area and Representative Mary Whiteford, who is the chair of the HHS Appropriations Subcommittee. She's from Allegan County. She's a nurse. She has Alzheimer's in her family, and she's really become a great champion on care issues. The other issue that is our top priority for the budget is the My Choice Home and Community-Based Service Waiver. Again, Mary Whiteford and John Hoadley have been incredible leaders on this issue. In the House version of the budget, we saw the 5% increase that we asked for. We saw a slight increase from 2019 appropriations in the Senate budget, certainly not anything near what we want, which is the 5% increase. So again, I met with Senator McGregor recently from the Senate side, and we asked him to commit to a 5% increase, and he said he can't commit to anything until he has a target, but he is inclined to follow the lead of Representative Whiteford, and he understands the value of the program. He understands that there is a significant wait list for that program and would like to see that wait list, cut down as much as possible. So I think, again, it's something that we can feel cautiously optimistic about. So in terms of our budget items, I think we're feeling pretty good. And what we're doing now is really focusing back in on the governor, particularly when it comes to My Choice, because her budget did include a a $8 million cut to the My Choice program. And that was at a point in time when this program had a 3,000 person wait list. And so we really want the governor to hear a clear message from all of the organizations that are concerned about My Choice. And there are quite a few of us at the table for this work, which is really cool, that My Choice is important. Home and community-based service programs are important. And we need her to be more of a champion on the issue. So, you know, her people will be involved in some of these conference committee discussions and negotiations. So we want to make sure that as they're trying to find revenue for roads, if they come to an agreement on roads, or they're trying to find revenue for something else, they're not pulling it out of, you know, the pieces of the HHS budget that we are concerned about. So this week, you likely saw an email come through with an action alert to send a message to the governor in support of an increased funding for the My Choice Home and Community-Based Service Waiver. This is done in conjunction with our coalition partners who have been activating volunteers to make calls into the governor's office and other groups that are sending emails into her office. We're really trying to keep a big, solid drumbeat going on this issue. In fact, we were commended by Senator McGregor for the work that we've done as a coalition on this issue. And so that certainly feels good when a legislator says, you know, that he appreciates the fact that we're coming in together, working from different angles to toward the same goal. So what I would ask is that if you receive that and you haven't taken action, please take action. There's also a social share option. If you're on social media, if you could share that on your Twitter or your Facebook account and help us spread the word to get those messages into the governor's office, that's going to be incredibly helpful. We will continue to keep you updated on what's happening with the budget, but I think most of the action will be after Labor Day and certainly probably toward the end of September. But I want to thank everybody for the incredible work that you've done so far on this, and we've really, I'm really happy with where we are right now with both of our priorities. I think we've made a lot of new friends in the legislature this year. I think our volunteers have really done an incredible job of going to town halls and writing letters to the editor and tweeting and following up with legislators and making phone calls to offices, and all of that has added up to get us to where we are right now. So we're in the home stretch and we want to bring this home and we want to be successful. So please take action. And if you didn't get that email from us, please reach out to Matt Phelan, M-E-Phelan at alz.org. Matt can make sure that you get a copy of the email, and then once you take action, you'll be added to our distribution list to receive additional emails when it's time to take action again. So if you have any questions, please feel free to reach out to Matt or reach out to me. We're happy to chat with you and hopefully have another update for you soon. Thank you so much.